I'm Dr. Bill Berman. I'm the Director of Public Health at Denver Health, and I'm happy to provide an initial update on the COVID situation in Denver. Things continue to improve, so the case rate continues to fall steadily. The percent of tests that are positive, another key metric, continues to improve. Continued improvements really across the city is the update for now. The upcoming availability of vaccine for school staff is certainly an exciting thing, and we hope to help DPS along with other healthcare systems starting next week in getting DPS staff vaccinated. That process is going to take several weeks. There's a large number of people to be vaccinated, but I think it's going to get started and work relatively quickly. Once vaccination has been done, it raises a number of questions about how vaccine status might change some things. So for example, quarantine. We don't have a formal policy from the state health department, but we've asked them for a meeting to work out those details. For other professions, the CDC guidance that just came out said that those who had completed a two-dose vaccine series did not need to be quarantined if there was an exposure. And so that's the question we plan to discuss in detail with the state health department. Will it change masking, cohorting, distancing, attention to hand hygiene? I would say no. Eventually, perhaps, but initially, no, not at all. I work in healthcare, and healthcare really is just completing the vaccination of most of its workforce, and I think that's gone well. The vaccines are highly effective. There are effects. Some people don't call them side effects because they're expected. A sore arm is common. Some systemic symptoms, fatigue, sometimes fevers, a chill are relatively common, particularly after the second dose. They're the symptoms of immune activation because that's what these vaccines do. They activate the immune system so that it recognizes and can respond to these key proteins of the virus called the spike protein. What I can say is that those almost all resolve quite quickly. So usually within just a day or two, most people who have symptoms are dramatically better. So in general, I think they're well-tolerated vaccines, but there are these symptoms that are quite common that really are the symptoms of immune activation. There is a monitoring system in Colorado centered at the state laboratory that looks for these. We need more numbers to be done, but I just saw a report from the state lab that showed that these variants, and they've been in Colorado, they've been almost all the UK variant, are appearing, but they appear to be 1% or less. The other reassuring thing is that case rates, both in Denver and across the state, continue to fall, suggesting that if there's an effect on transmission, they're not common enough to impact overall population transmission rates. So I think it's certainly a concern going into the future, one that we in the state health department will be monitoring very closely. But I don't see any need to change our plans at present. I can comment a little bit about the potential for these strains to impact vaccine protection. The best data we have from the United Kingdom suggests that the two vaccines that are licensed in the United States, Moderna and Pfizer, retain marked activity, probably full activity against the UK strain. There are more concerns about the potential for the South African and the Brazilian strains to perhaps decrease vaccine efficacy, not take it away completely. Again, some of that is suspected but not proven. I guess one thing that I can take comfort from is the demonstration in the United Kingdom, where well over half of all the circulating strains are the so-called UK variant. They've just achieved a greater than 50% reduction in case rates over the last few weeks, showing that even in the presence of high levels of the variant strain, the combination of social distancing measures, the DPS-5, plus vaccine can be highly effective in reducing case rates. The first thing I'd say is that the KN95 masks that DPS staff are given are excellent masks, and there's no reason to try to get something in addition to that. They're actually better than the masks we're currently wearing in healthcare. So I wouldn't see a need for that. Some people have mentioned, should individuals who don't have those masks double mask, perhaps with a surgical mask, with a cloth mask on top of it. I think those are interesting suggestions, but I don't think they need to drive policy right now. I think the key thing is to get all of us to wear our masks. That is far more important than the details of whether it's a single mask or a double mask. We worked with the state health department to revise the guidance on quarantine in school settings, and really what we worked with them on was applying the same criteria that we use in other settings to the schools. So in other settings, work settings, for example, we don't quarantine entire work sites in general. We look for those individuals who had close contact for a significant period of time. And so the definitions that the CDC recommends are within 6 feet and for 15 minutes or more cumulatively. And so in essence, that's what we and the state health department now recommend to schools, is the same criteria that we use in all other settings. That is both distance and time.